So today we're going to go up on the helipad to meet London's air ambulance pilots. And London's Air Ambulance is a charity that's funded by the people of the United Kingdom, and they transfer 5 critically ill patients across London every single day. Hey everybody, we're just up on the helipad at the Royal London Hospital, and I've got Captain Thomson and Captain Jeffers with me, and we're just going to have a quick chat about what these gentlemen do as London Air Ambulance pilots, or HEMS pilots. Firstly, what made you want to become pilots?
I think I'd have to say very simply, my father was a pilot, my grandfather flew, etc., so I think it's probably inherent. Okay. I think I was ready to do it when I first flew a plane when I was about 8 years old. So I've been flying forever, really.
Amazing.
I'd like to say the same thing, but it wouldn't be true. I grew up watching Airwolf and then decided I wanted to be a pilot.
Amazing. That's what made me want to become a pilot, but never got there eventually. What made you want to fly with HEMS?
Yeah, I think for me, at least, I've been doing most of my flying around London. So London being the super coolest town, being able to help people and working with this world-renowned team flying around in London was ultimately the reason for me.
I used to fly out of Aberdeen and Shetland to the rigs and boats in the North Sea. When the job opportunity came up here, I thought flying around London would be great, but I didn't realise just how rewarding it would be, especially with the patients and the medical side. So yeah, it's extremely rewarding and a great, challenging job.
What's one of the best things about the job that you do?
I think it's a team, a small team we have. It's everybody trusts each other. We have 2 crews, so a captain and a co-pilot, like you would have on an airline if you went somewhere. And then we've got at least 3 medical teams at the back, and sometimes a patient. It's that crew and that synergy, everybody working together, knowing their role, knowing their responsibility, and I guess you've got each other's back, and you're working in quite a challenging environment, obviously with some very sort of challenging patients.
I totally agree. I think there's 2 things. I think, as Andy says, working with the team is absolutely brilliant. So even as pilots, we had to help out the medics on the ground as well, and they help us in the air. So it's a big team, and it's a pretty close-knit team. The other thing for me is certainly the sense of satisfaction.
Right.
Every now and then a patient comes up that you remember from maybe a year ago or 6 months ago, who you saw last in the worst time they've ever had, and they come up and see you and just say that was brilliant. That's just incredibly rewarding. That's a big part of it.
When you're initially called out, what are the first kind of thoughts that go through your head?
Yeah, so first of all, is purely the job, is finding the location. So I, as the captain, won't find out what the mission's about. My sole purpose is to communicate with Heathrow and get to the job, and that's certainly what we're thinking about.
And that's done on purpose? Is that to kind of maintain focus?
It is consciously. We've talked about it a lot before. We've decided that it's best that we don't know. We would hate to be suffer the red mist concept and land where we shouldn't do just because we thought there was someone more injured than usual.
Sometimes the initial the job, the details you get might not be true anyway. So you're going to an 18-month-old, might be an 18-year-old, or vice versa.
Right.
So you just stick to your training. You do your job, you do your role, and then the job sometimes progresses and it goes on.
Also, we don't get a whole lot of time to think.
Yeah.
Our average flight time is about 6.7 minutes. So from the bell ringing, we're up here and airborne within 4 minutes, flying across London. The furthest point in London in 11 minutes. But the average flight time is 6 minutes. So we're racing around and not a lot of time to think sometimes.
As surgeons, we often have to think about if you're constantly in high stress environments and you're dealing with high pressure situations all the time, you constantly have to think that you're not getting burned out or you're not getting affected by the things that you're seeing. How do you deal with that?
I see it's our job as pilots to look after the helicopter and the team. It's the team's job to look after the patient.
Yep.
And if it's a very difficult, challenging patient case we go to, and emotionally and fly that team and that helicopter back to the hospital or back to the next patient, back to the next job. So you can't kind of get too involved, and you can't cloud your judgment. We'd be more worried about something going wrong with the aircraft or something with the aircraft. So that's our responsibility. And I guess for me, I see it as the patient is it's a whole team's responsibility, but I'm primarily looking after the team and the aircraft, and they're primarily looking after the patient. So I leave that to them.
Yeah, so you kind of compartmentalise things and separate them out a bit to maintain focus. Okay. I don't know if you're allowed to say, but what's the scariest thing that's happened to you when you've been out on call?
You see, we don't do scary. That's a clever thing. See, we're lucky that we're in control of our destiny, and we are pretty shy about these sort of things. So if we're going to we don't land in tricky landing sites, we land in sensible, safe landing sites.
Yeah.
But I think the weather plays a big part.
Sure.
And sometimes when there's thunderstorms around, visibility is bad or the cloud is low, we elect to stop eventually. But I think around those, I think that's probably the times where we have to work a little bit harder, and it can be concerning sometimes.
If there are aspiring people out there who would like to become helicopter pilots or even HEMS pilots, what kind of major advice would you give to them? Or maybe
Get
one
lots
piece
of money.
Really.
Get a medical first of all. Get some money, some time organised, and then it's hugely rewarding. It's not the best paid job in the world, right? People do it for the love for it.
One last question, I suppose. What's the coolest place you've landed?
Piccadilly Circus, I suppose, is quite
that's pretty
a good
cool.
place. Between the fountains and Piccadilly Circus is not bad.
Buckingham Palace.
Okay.
I did think we might end up in the tower at one point. We tried to avoid the corgis and the swans.
Yeah,
but,
We're lucky enough to be able to land whatever we like when it's required. So it's
and at the time, those were the safest places. Trafalgar Square or Piccadilly Circus or Buckingham Palace or one of the bridges might not sound that safe, but if there's something going on or the traffic's blocked up and the roads are chaos or there's just people everywhere, we just find the biggest, safest place near as close to the job as possible, and sometimes just happen to be those places. So.
And how do you kind of tell the pilots that you're going to land in the garden?
Yes, how do you do that?
We've got sirens on the aircraft. We've got lots of flashing lights, and often the co-pilot's hanging out the door. And,
Okay. Yeah.
And we won't necessarily land the first time. If it's not safe, we'll perform a safe go around. And normally people on the ground will get the idea, and sometimes it might take a few passes. We land in the middle of London in a park, and summertime it's full of people, and that might take a couple of orbits. People kind of get the idea and move out of the way and gather all the belongings. But
when I was a medical student at George's, I saw you guys land in the park just outside with all the kids running around and playing underneath. I saw you just circling around, and all the mums and dads are trying to
herding them out of the way.
Absolutely.
And the guys on the ground are brilliant, and sometimes just members of the public who just realise what's happening, and they can move people out of the way, stop traffic for us. The police are great, the fire brigade, they'll help and support us as well. So we don't know until we get overhead, and we've got the best bird's eye view of the safest places to land, and we'll just choose whatever safest. And if we see a hazard, see an obstacle, we'll go around and either try again or find somewhere else somewhere safer.
Amazing. Thank you so much. Thanks for your time.
No, thank you.
Pleasure.
And I hope you have an uneventful afternoon.
Fingers
Thank you.
crossed.
Thanks a lot.
Thanks
Cheers.
a lot.
See you later.
Cheers.
Bye.
Thank you.
Have a good day. Cheers.
Thanks a lot for watching this episode of the Brain Surgeons vlog, which we did in conjunction with London's Air Ambulance. If you want to see more of these videos, don't forget to subscribe, like and share. See you next week.